Hi kids, welcome back again to our video lessons in science subject. We are now in quarter 3, week 3 and 4. The reference that I am using from science links can be found on page 113. Your teacher, Mr. Ray D. Montesille. At the end of this lesson, you're expected to understand causes and treatment of diseases of the major organs. Please prepare the following: your ball pen and paper. This is a sample worksheet paper that you are going to use. Class, for today's lesson, you will be learning about the causes and treatment of the diseases of the major organs. This lesson can be found on page 113. This time, we will be learning about the brain diseases. Brain diseases vary depending on the specific pattern that might occur. Damage may be permanent and in some cases fatal. Common diseases are Alzheimer's disease, dementia, stroke, Parkinson's disease, brain tumor. Alzheimer's disease, it is irreversible loss of neurons and loss of intellectual. Causes attributed to aging and stress. Treatments, medicines and other types of supplements may help slow down AD. Dementia, it is brain cell damage that may lead to Alzheimer's disease. Causes, depression, medical side effects, excessive alcohol intake, vitamin deficiency. Treatments, prescribed medications, therapy, proper diet, physical exercise. Stroke, it is inability to move one or more limbs on one side of the body. Causes, loss of blood supply in the brain caused by hemorrhage. Treatments, being referred to a neurologist, therapy, prescribed medications. Parkinson's disease, it is progressive loss of muscle control which results in difficulty in walking, talking, and completing simple tasks. Causes, lack of dopamine, a simple organic substance in the brain. Treatments, prescribed medications, physical therapy, and surgery. Brain tumor, it is group of similar cells that does not follow normal growth, later on develop into a large mass of cells. Causes, high radiation exposure. Treatments, treated with surgery, radiation therapy, and chemotherapy. Now this time, let's learn about heart diseases. Heart diseases share common traits but vary in progression and treatment. Being familiar with it may help you better understanding it and be more in control. Common heart diseases are congenital heart disease, congestive heart disease, angina, chest pain, rheumatic heart disease, high blood pressure, or hypertension. Congenital heart disease, it is an abnormality present at birth which might have affected the fetus as it developed in the uterus of its mother's womb. Viral infections, excessive medications, chemicals, and alcohol may be some of the causes of congenital heart disease. Treatment depends on the specific defect of the child. Congestive heart disease, it is a condition most common to older people. It occurs when the heart can no longer pump blood to the rest of the body parts. Heart attack, high blood pressure, diabetes, coronary artery disease, cancer treatments, and other health-related issues may cause this kind of condition. Lifestyle adjustments like low-salt diet and high fluid intake, wearing of special elastic stockings to reduce swelling of legs causes better retention, appropriate weight loss program, prescribed medications, and doctor supervision may help a lot in treating congestive heart failure. Angina or chest pain, it is a condition that often causes pain or tightness in the chest area, creating a sort of squeezing sensation that is sometimes accompanied by indigestions. The discomfort can also occur in your shoulders, arms, neck, jaw, or back. Smoking, getting high amount of certain fats and cholesterol in the blood, high blood pressure, and high amount of sugar in the blood are some of the main causes of having angina. Prescribed medications are lifestyle changes that include a healthful diet, quitting smoking, having a safe exercise plan, avoiding stressful activities, and undergoing operations such as angioplasties, stenting, insertion of a tiny balloons in the narrowed artery through a catheter in the groin to keep the artery open. Next, rheumatic heart disease. It is a common cause by one or more attacks or rheumatic fever, which usually occurs in childhood, caused by infection that weakens the heart muscles and damaging the sacs and valves. High blood pressure or hypertension. It is a condition that results due to excessive force of blood being pumped through the blood vessels. It may cause stroke, heart failure, and renal disease. To prevent high blood pressure, everyone should be encouraged to make lifestyle modifications such as maintaining a healthier diet, quitting smoking, and getting more physical exercises. Now, let's talk about lung diseases. Lung diseases is one of the most common medical conditions that need immediate medical attention at once. Smoking, infections, and genetics are some of the most common causes of lung diseases, which can result to more serious problems. Common diseases are asthma, tuberculosis, allergies, chronic obstructive pulmonary disease, pneumonia, and chronic bronchitis. Asthma. It is a condition wherein the airways are inflamed, causing wheezing and shortness of breath. Tuberculosis. One of the most fatal respiratory problems. It is caused by a bacterial infection that mainly affects the lungs. The bacteria that causes tuberculosis may spread one person to another through tiny droplets released to the air through the coughs and sneezes. Allergies are usually caused by infections or any type of pollution that can trigger asthma symptoms. Common allergens include drugs, dust, food, molds, pollen, pet, and animal fur, and reactions to sudden changes in weather temperature. Chronic obstructive pulmonary disease. It is a condition characterized by the inability to exhale normally, which results to difficulty in breathing. This cannot be cured but can be treated by avoiding tobacco smoke and air pollution. Pneumonia usually starts when you breathe the germs into your lungs. You are most likely to acquire this disease after having a cold or flu, especially if it is not treated properly. Chronic bronchitis. It is an inflammation of the bronchial tubes that causes cough with mucus, shortness of breath, wheezing, and chest tightness for a long period of time or sometimes chronically. Illnesses affecting the liver. A variety of illnesses affects the liver. It is said to be the only organ in the body that can easily replace damaged cells. But if the loss of cells continues, the liver may not be able to meet the needs of the body. Common diseases are cirrhosis, hepatitis A, hepatitis B, liver cancer. Causes: amount of alcohol, contaminated food, virus or toxins, and smoking. Treatments: transplant, rest and proper healthful diet, medications, vaccinations, surgery, and chemotherapy. Stomach problems. There are a lot of stomach problems or diseases. Some are mild, but others can be severe or life-threatening. Common problems are indigestion or dyspepsia, gastritis, stomach bleeding, peptic ulcer. Causes: swallowed air, inability to digest milk or dairy products, anxiety or depression, too much alcohol drinking, long use of anti-inflammatory drugs, or infections with bacteria. Stomach bleeding in the inner lining of the stomach usually caused by gastritis and sometimes may cause tumors or cancer of the stomach. Weakening of the stomach walls, which release an acid that causes the pain. I hope that you learn and understand something. For your first activity, you're going to answer directly on your paper. Just write true or false. You have to answer 1 up to 10. For your test 2, just copy and answer on your paper. Describe each common disease below. You have to answer and describe from 1 up to 10. For your test 3, just enumerate some common diseases on your paper. From brain diseases, 1 up to 5, heart diseases, 1 up to 5, and illnesses of liver, 1 up to 5. Always remember class, just keep your paper or worksheet activities and pass it to the next submission every Monday. Video lesson has ended class. Thank you for listening and goodbye.